6-year-old Juliette Amure Catalan was deemed extremely clinically vulnerable to infection by the family's paediatrician. Her mother, Anita, has kept her out of school for the past year and doesn't want her to return until she can be vaccinated against COVID. Today's decision by the Department of Health to remove all under-18s from the shielded patient list has left her fearful.
It seems very strange to me to then put children in this vulnerable situation and expect them to go back to school when they've known they've been very vulnerable for a year. I'm quite surprised to see them removing all shielding at a time when we are dealing with the Delta variant and we are going back to school with no measures in place to protect children.
But for the vast majority of children, say experts, the risk is minute.
I think the first thing to say is if you're really concerned, talk to your paediatrician. The data tell us that even for children that we would have assumed were very vulnerable to COVID, actually they're much more vulnerable to other things, and there are real harms in shielding. Even for children with life-threatening conditions, actually the chances of dying from something else that isn't COVID were about 65 times higher than dying from COVID.
Vaccines are available for children deemed at risk, but right now only for over 12s.
Studies are being done with the Pfizer vaccine and actually with other vaccines as well in younger children. And there may well be a relatively small number of children who will be at high risk, who will need to receive the vaccine. As to whether vaccine will need to be given more broadly to younger children, I think that's very much an open question.
It's little comfort for parents concerned about the risks of COVID. The balance of evidence tipping toward the benefits of participation in school and wider society and away from the potential harms of a new virus. Tom Clark, News at 10.